Good evening and thank you for joining us. Tonight, the COVID tidal wave health officials warned about is here, with the U.S. shattering its single-day record of new cases. And the big concern tonight, pediatric hospitalizations and childhood infections are also setting pandemic records. The fast-spreading Omicron variant is being blamed for all of it, with cases doubling every few days. And there's some breaking news tonight out of the CDC after facing criticism from top health officials about its guidance for those isolating with COVID. There's a new update on what you should do after testing positive. And we're also seeing long lines of people at testing sites. Hospitals and their staffs also pushed to the brink. One in Fort Lauderdale, Florida, was forced to close its maternity ward because of COVID-related staffing shortages. And it's not just healthcare. Museums and stores are also impacted. Macy's tonight announcing it will cut store hours for the rest of the month. CBS's Omar Villafranca is outside a testing site in Fort Worth with the very latest. And Omar, let's begin with that new guidance tonight from the CDC.
Good evening. The CDC originally said you should isolate for 5 days if you test positive. Well, tonight they have updated their guidance. They're saying after isolating for 5 days, if you still have symptoms, you should get a COVID test, but it's not required. That's if you can find a COVID test. These people are waiting in line to try to get one of those tests at one of 8 locations here in Tarrant County. What they're finding is not good. The positivity rate here in Texas is more than 33%. Omicron is omnipresent. The CDC announcing today it now makes up an estimated 95% of all cases nationwide. Dr. Peter Hotez with the Baylor College of Medicine says Omicron may not be as severe as Delta, but it is spreading faster.
Well, it clearly is more contagious, more transmissible, and it looks like it's reaching levels that almost approximate measles, which is really the most common, highly transmissible virus agent we know. What we'll see is this wave of Omicron will ultimately be as serious and dangerous as previous waves.
As new COVID cases topped 1 million, COVID hospitalizations reached more than 100,000 nationwide, numbers on par with last summer's Delta surge. And now, COVID cases in kids are higher than at any point in the pandemic. Only 33% of kids 5 to 17 are fully vaccinated. More than 325,000 pediatric cases were reported for the week ending December 30th, and hospitalizations are at the highest they've ever been, 672 a day, a 114% increase since last week, all as kids head back to school. Dr. Mary Suzanne Whitworth of Cook Children's in Fort Worth, Texas, has watched as more kids are admitted to her hospital, a majority of them unvaccinated.
Over the last 2 weeks, they've tripled and quadrupled in numbers. It's been a rapid rise.
The number of patients isn't the only concern. The surging number of cases means healthcare workers are also getting infected and can't report to work.
And that's the danger point of Omicron, is that 1-2 punch of people still coming into hospitals and not enough healthcare providers to take care of them.
With the holiday weekend over, people from California to Texas to New York are waiting in long lines to take a rapid or PCR test, if they're available.
I spent 2 days trying to find a place.
Because of surging cases, more than 215 school districts across the country have switched over to remote learning. In Chicago, there might not be any classes tomorrow if the teachers union votes tonight to refuse to go to work in person. Norah, that is the nation's 3rd largest school district.
Omar Villafranca with all those details. Thank you.